Ontario's long-term care homes are becoming a breeding ground for COVID-19. As of April 16, 933 long-term care residents across the province have tested positive for the virus. 162 have died. Ontario has a total of 626 long-term care facilities, 104 of which are dealing with outbreaks, at least 17 of which are in Ottawa. 530 staff members who work in these institutions have also contracted the virus, meaning there is now a shortage of nurses. Today, the province of Ontario put new measures in place at long-term care home facilities to stop the spread of the virus. It comes after half of the deaths reported in Canada were from residents of long-term care homes.
We're in a fight of our lives right now, in the fight against this virus.
On Wednesday, Premier Doug Ford said COVID-19 is a test that will define us as people and as a province. He announced an enhanced action plan in long-term care facilities, which includes hiring more staff, restricting all non-essential visitors, offering 24/7 screening for all staff and residents, and stepping up cleaning measures in these facilities. The goal, he said, is to give staff more supports they need.
We will ensure the staff at these homes have the tools they need. That means strengthening protocols, training, and education on infection prevention and control. And it means ensuring priority distribution of personal protective equipment. We're getting PPE to long-term care homes in need within 24 hours or less. We'll put more boots on the ground. We're putting together COVID-19 SWAT teams drawn from our hospitals, home care, and public health care units to help homes manage outbreaks.
Healthcare workers in long-term care facilities will now also only be able to work in one institution, the province covering the cost for increasing hours for part-time workers. It's a decision other provinces like British Columbia made weeks ago. Ontario will also pick up the bill for increasing staff in homes which have experienced an outbreak of COVID-19. Testing will also be ramped up in facilities, with all residents and staff being tested if they may have come into contact with an infected person.
And over the next 48 hours, we will be launching more aggressive testing, screening, and surveillance by screening all symptomatic staff and residents, as well as asymptomatic contacts of confirmed cases. We will be enhancing testing in all homes with a targeted plan for homes in outbreak, and testing of asymptomatic residents and staff in select homes across the province to help inform understanding of spread in long-term care homes.
Ontario, however, is still experiencing a backlog of tests, with close to 6,000 people awaiting results. It comes after 8,900 people were tested yesterday, a number which is increasing as more healthcare workers and long-term care residents get tested. As for personal protective equipment, Mary Lee Fullerton, the Minister of Long-Term Care, said equipment will arrive at the facilities 24 hours after the order is placed. Family members who have loved ones in these institutions say this is welcome news, but it did not come soon enough. Now that testing is being ramped up, the number of confirmed cases in long-term care residences is expected to increase. As of today, 16 institutions in Ottawa have an outbreak of COVID-19. Charlie Cenac, WIN News, Ottawa.